Welcome to H&HN Daily. I'm Suzanna Hoppszallern, Senior Editor for Hospitals and Health Networks magazine. To effectively and efficiently manage the healthcare needs of patients and populations, nurses are taking on leadership roles in collaborative practice to improve outcomes and reduce costs. Today, I'm joined by Beatrice Kalisch, the Titus Distinguished Professor of Nursing and Director of Education, Evaluation, and Innovation at the University of Michigan School of Nursing in Ann Arbor, Michigan, to discuss nurse leadership and team-based collaborative care. Welcome, and thanks for joining me today. What is team-based collaborative care?
That's when all the members of the healthcare team work together to achieve common goals. So it's nurses, it's physicians, the physical therapists, the radiology technologists, the pharmacists. All of them have a part in giving care. We all have to work together.
And how is the nurse providing input in terms of monitoring and feedback to ensure that the collaborative process works? Well,
there's 8 elements of teamwork. It isn't just one thing. It's 8 different behaviors we found in research. One is to have an orientation that the team's the most important thing, not your individual needs. And another is to back one another up. But you monitor each other before you can back each other up. So you should be monitoring one another. And if you work in the same geographic area, you can monitor each other right then and there. If you're like a physician and you're in a different spot, the monitoring has to be more virtual. But that's an essential element of teamwork, because it's just as much my responsibility to wash my hands as it is my responsibility to make sure you do too, and vice versa. And it isn't in a negative way, but we are responsible for all of us. It's a different way of looking at our work than has been traditional.
You've done research on missed nursing care and how that can impact the patient quality, outcomes, the satisfaction, and particularly in something like a patient falls. How can teamwork improve the care?
Well, teamwork, I've done a study that shows that the better the teamwork, the less the missed nursing care. Missed nursing care is required standard care that isn't getting done. So I did several studies, and I've seen a consistency across hospitals. And in terms of teamwork, like for falls specifically, if a patient is there's all kinds of things we do with patients to make sure they don't fall. We put them on fall alert. We have, sometimes they have a bed alarm on when they start to get out. Then everybody needs to get in there right away. If they're not working as a team and they say, well, that's so-and-so's patient, not mine, I'll just keep doing my work, then you have more falls.
With missed care, are there some commonalities that you've found across all hospitals?
Yes.
What are the major ones?
Ambulation is number 1 across every hospital, and also in other countries like Turkey and Lebanon. It's amazing to me. The other ones are late medications or not delivering medications. Turning is another one. Attending interdisciplinary care conferences. And that's again shows the teamwork problem. If you don't work together and don't have time to talk with one another, you can hardly develop goals that are usable for getting the work done. You have to be on the same page. I call it shared mental model.
How can we engage the patients and their families to help us with missed care in the hospital?
We need to tell them and educate them on what care they're supposed to receive and why. And if we do that, we need to also ask them to help us remember if something doesn't get done, just like we've asked them to help us with hand washing. If they see we haven't washed our hands, they're supposed to tell us.
And how will this impact the patient's discharge instructions and their follow-through after they leave the hospital?
That's very important, because if the patient knows learns more in the hospital about what needs to be done and why, they are much more likely to do it when they go home.
Thanks for joining me today.